Assalamualaikum guys, today we are talking about the spinal curves. As views in the plane, the spine contains four normal curves, the thoracic and sacral curves, which are concave anteriorly and are present at the birth and are referred to as primary curves. The lumbar and the cervical curves, which are concave posteriorly, develop from supporting the body in upright position. After young children begin to sit up and stand. Because these curves are not present at birth, they are known as secondary spinal curves. Although the cervical and thoracic curves change little during the growth years, the curvature of the lumbar spine increases between the ages of the 7 and 17. Spinal curvature posture is influenced by hereditary pathological conditions and individual mental state and the forces to which the spine is habitually subjected. The mechanically curves enable the spine to absorb more shock without injury than if the spine were straight. As bones constantly modeled and shaped in response to magnitude and directions of the forces acting on them. Similarly, the forespinal spinal curvature can become distorted when spine is habitually subjected to asymmetrical forces. Exaggeration of the lumbar curve or lordosis is often associated with the weakened abdominal muscles and anterior pelvic tilt. The causes of lordosis include congenital spinal deformity, weakness of abdominal muscles, poor postural habits, and overtraining in sports requiring repeated lumbar hyperextension, such as gymnastics, figure skating, javelin throwing, and swimming. The butterfly stroke, because lordosis places added compressive stress on the posterior elements of the spine. Some have hypothesized that excessive lordosis is a risk factor for low back pain development. Obesity causes reduced ROM and the entire spine and pelvis, and obese individuals display increased anterior pelvic tilt and an associated increased lumbar lordosis. Anterior pelvic tilt and increased lordosis are also increased during running as compared to walking. Another abnormality in the spinal curvature is kyphosis, exaggerated thoracic curve. Kyphosis can result from a congenital abnormality, a pathology such as osteoporosis and Scheuermann's disease, in which one or more wedge-shaped vertebrae develop because of the abnormal epiphyseal plate behavior. The Scheuermann disease typically develop in individuals between the age of 10 and 16 years, which is the period of most rapid growth of the thoracic spine. Both genetic and biomechanical factors are believed to play a role. The condition has been called as swimmer's back because it is frequently seen in adolescents who have trained heavily with the butterfly stroke. Treatment for the mild cases may consist of the exercise to strengthen the posterior thoracic muscles. Although bracing or surgical corrections are used in more severe cases. Thoracic kyphosis also tends to increase in both genders with age as a function of degenerative changes, vertebral compression fractures, muscular weakness, and altered biomechanics. Note that the relatively flat spine of this 3-year-old, the lumbar curvature does not reach full development until approximately age of 17. Thank you so much.